Muscle and injury recovery. This is an image of a leg with acupunctural needles in it. Acupuncture is used in athletics in order to assist in recovery time and to stimulate muscles and nerves in order to let the athlete perform better. This image is a map of pressure points and nervous points on a male used for acupuncture. And in continuation of the last image, here is the front side of a male with all the pressure points. Cryotherapy is the use of extreme cold in surgery or in other medical treatment. It is used to assist in healing of wounds and injuries, specifically stuff like bruises and slight small cuts where you would just put a bandage on it. Here is an image of Floyd Mayweather enjoying his cryotherapy chamber for specifically that injury recovery. Hyperbaric oxygen therapy is a medical treatment which enhances the body's natural healing process by an inhalation of 100% oxygen in a total body chamber. By increasing the oxygen level, it forces your body to carry more oxygen in your blood, which then makes it much easier for your cells to regenerate naturally, making the healing process not only faster but much more efficient. Cupping is a process that many professional athletes strongly attest to. Essentially what it is putting little glass cups across the skin around the injured area so that there will be a vacuum pulling blood and skin to the surface. When the blood is pulled to the surface, it makes blood flow faster, bringing more and more blood as blood is pushed out quickly, bringing oxygen flow and raising the rate of recovery. Injured quadricep. Usually no longer than about 4 weeks. However, this will change if the muscles are torn completely, in which case it would be closer to 7 or 8 weeks. And this is per muscle. And since there are 4 muscles in the quadriceps, it can take up to 7 to 8 months, which is not great, not fun. And if it is torn completely, then the muscle will either roll up or down the leg, depending on which side was closer and which side got torn. And it will ball up and become super tight and will require surgery. ACL injuries are oftentimes career enders. If you tear your ACL, you are required to have a surgery. And after the surgery, there is a 6-month period of time where the injury is completely inhibiting the patient from any physical or active engagement. This means no movement at all. Basically stuck in a wheelchair, although you may be using crutches. And finally, to the old bicep, the muscle we all know and love. For complete tears, the recovery without any special treatment is a maximum of 6 months. Partial tears usually range from 2 to 3, and this is without any of the treatments you've seen before or will see after this. And that's not fun, especially since it hurts the entire time. This method, known as the Regenicin treatment, is the process where anti-inflammatory factors are pulled away from a patient's blood, manipulated and heated and centrifuged, and then reinserted into the painful areas of the patient. Essentially, what's happening to the patient is they're having their blood drawn, separated into multiple parts, being the inflammatory bits and the red blood cells and healing factors of the blood. After being heated and centrifuged to separate the blood, a thin yellow layer will form on top of the red blood cells. This is essentially the good stuff, or the newly concentrated cytokines that focus on getting straight to healing and relieving pain. This process may not make the body react immediately. Sometimes it takes a few weeks, may take a few minutes, but that is almost always better than a few months. And in this image above is a representation of what the Regenicon treatment is, and it's just rebuilding your own body with your own body.